Hi, this is Dr. Centeno, and we're going to go over these two new studies about taking cholesterol drugs and blood pressure medications if you don't have a history of heart disease. Now, the single biggest pharma business model by far worldwide is treating people who aren't sick to try to prevent heart attacks and strokes. Now, two new studies published in this prestigious medical journal tested drug combinations with regard to cholesterol meds and blood pressure lowering meds. They both focused on people who really didn't have any heart disease. Now, we know that these medications can hurt adult stem cells based on research that we've done and others have published, but the bottom line is, how big of an effect is there with these drugs? Meaning, are we harming patients by taking them off of these drugs for a stem cell procedure? So how well did they work in these two prestigious studies? They worked really poorly. After 5 years of taking the drugs, the risk of dying from heart disease was reduced by a measly 0.3% in one study and 0.5% in the other. Now, using the best published results, your chances of seeing any benefit with regard to dying from heart disease after taking these drugs for half a decade was 1 in 397. And given that a bunch of common things you can do can substantially reduce your cardiac risk, why would you take these drugs? So, if we ask this question again, these results are statistically significant but clinically meaningless. For instance, if you did this study with 1,000 patients, and these were done with 6,000 and 12,000, you wouldn't have seen any difference between these groups. And the side effects of these drugs are huge. So the bottom line is, at the end of the day, the results from taking these drugs are really piss poor. So you have to make the decision as to whether or not you take them, but certainly based on the research, I wouldn't put my patients on these drugs. Thanks so much and have a great day.